Hello and welcome once again to the Steer series of videos by Dr. Amdekar's team. I am Dr. Tushar Maniar, pediatrician from Andheri, and I'll be talking on clinical examination of a joint swelling today. Whenever we come across a joint swelling or severe pain, we must rule out joint threatening or life-threatening conditions. What I mean by that, if you see a joint which is red, very painful, associated with high fever, child is having no weight bearing, and there is severe restriction of movement. Think about septic arthritis. It could be a severe trauma, hemophilia, or sometimes a manifestation of a systemic condition like Kawasaki or leukemia. Once we have ruled out the red flags, we go systematically through general examination. So look for vitals, make sure there is no fever, assess the child's growth because that will give us whether this disease or condition is acute or chronic. Next, we must rule out do focus clinical examination for examination of eyes, examination of heart, look for any skin rashes or any peculiar skin features which could be suggestive of any other rheumatological conditions. We should not miss on any petechiae, purpura, or any injury marks associated with this particular joint swelling. Next, we go on to decide whether this particular joint in question is the only one affected or there are other joints which are not noticed by the patient or the parent. And we do this by a simple screening examination called as PGALS. That means pediatric gait, arm, leg, and spine examination. This is a 2 to 3 minute standardized clinical examination for musculoskeletal evaluation. This will tell us if there are any other joint whether there is any other joint involvement apart from the joint which has been complained about. Then we go on to do the focused examination of the joint. Here we want to decide whether this particular swelling or pain is articular or is it an extra-articular problem. So when you examine the patient and the swelling is on or outside the joint line, think about a synovial problem, a bursa problem, or a meniscal problem. If there is only point tenderness or swelling is on one side of the joint, then also consider extra-articular condition. When you do compression of the swollen joint without moving the joint and there is not much pain, that suggests that this is not articular but an extra-articular swelling. Now we move the leg with active movement and passive movement. If the pain is there only on active movement and not on passive movement of the joint, again think about extra-articular problem. Because the articular disease will have pain on active as well as on passive movement. Once we think about this as an articular problem, do a focused clinical examination, check for swelling, check for redness, and check for warmth and tenderness over that area. Also, you move the joint in the full range and see what is the limitation of movement, which particular movement is affected, and make a note of how much the movement is affected. At the same time, make sure to note about any hypermobility and muscle strength around that joint as well. Look for contractures if they are causing limitation of the joint so as to not being misled in assessment of the range of movement. Look at the joint in its position to understand whether this is a position of comfort. What do we mean by position of comfort? The child with a swelling will keep the leg or the hand in a particular way which gives that particular joint maximum joint space. So for example, the knee joint when kept in slight flexion will give extra space to the joint, and so the pressure will be less and the pain will be relatively reduced. Similarly, externally rotated hip joint at rest will give you an idea that there is something wrong with the hip joint. Now we want to think about what is the type of problem that we are dealing with when we do the assessment of the joint. So if you get the patient complaining about pain at the initiation of the movement or initiation of the activity but is relieved on rest, then think about inflammatory condition. On the other hand, if the patient gets better on rest and increased pain on activity, which worsens with the activity, then think about either a mechanical problem or a non-inflammatory condition like osteoarthritis. It's also important to note which is the predominant feature, pain or swelling. Because if the pain is out of proportion to swelling, think about conditions like acute bacterial infection or rheumatic fever. On the other hand, if there is swelling but not so much pain, then think in terms of juvenile rheumatoid arthritis variants. And in India, if you have a monoarticular joint with swelling but hardly any pain, rule out tuberculosis. When we are looking at the joint, do not restrict yourself only to the joint examination. Make sure that you examine the bone around it, and if there is, especially if there is history of fever, then start from non-painful area to painful area by palpating to look for any point tenderness, which will tell you that we are dealing with a situation of osteomyelitis. Also make sure that you check for muscle strength, because that will give you clues along with that joint pain or swelling for various rheumatological conditions. And whenever there is any problem of one joint, make sure that you assess the joint above and below at least. So that will tell you, because sometimes there are referred pains, which is from the thigh, it can go on to the knee, or from the hip also it can go to the knee, and you should not be missing any of those. Also, sometimes early in the disease, the child may come with some complaint but no obvious finding. At that time, you can do maneuvers like stressing the joint. So this is exactly opposite of comfort situation of the joint. That means you move the joint in such a way that there is minimum joint space. So you do hyperextension of the knee joint, and if there is pain only on last 10 or 15 degrees, then you know that something is happening inside the knee joint. Similarly, internal rotation of the hip joint will also cause pain in early cases of transient synovitis and many other hip-related abnormalities. Patellar tap will tell you whether there is synovial collection or not. But if there is any doubt, then you can do certain maneuvers to push the fluid on one side and then perform the patellar tap. This will help you diagnose a condition earlier and help you go ahead with management better. If your history and the findings are not corroborating, or if there are multiple injuries over a period of time, or if there are certain swellings, like for example axial fracture of the humerus or fracture of a large bone or any hematoma or injury marks, do not forget to assess this child and the family for non-accidental injuries. Finally, friends, to summarize, whenever you have a child with joint swelling, rule out life-threatening or joint-threatening conditions. Do not forget to do a detailed general examination. When you are examining the joint, perform PGALS to look for other joint involvement. Make sure that this is articular versus extra-articular problem. Assess for range of movement, whether the child is keeping the leg in comfort position, and try to pick up an early problem by stressing the joint and ruling out other medical conditions. Thank you for your kind attention.